So thanks everyone, you can hear me all right, okay. I'm going to be talking about our study that we did with colleagues from Delft University of Technology, KU Leuven, Farsight Security, ICANN, and SIDN labs. And I want to give a special thanks to Victor Pochat, who also presented earlier today, and who also got a Distinguished Paper Award. And he did a lot of work for this paper too. Okay, so I want to take you back to 2020, the year of COVID. When the WHO first coined the coronavirus name of the virus, we saw a surge in registrations of domain names related to the virus. With a peak in March, where at some point more than 5,000 new domain names were being registered per day. On the right-hand side, you see an example of such a website, a very sketchy web shop. I didn't actually order anything here, but I want to remind you that this is from a time when the health guidelines weren't very clear. We didn't know what to do with this virus, and there were all these criminals trying to make a buck from our fear. And this is something we've seen also with natural disasters and other fear in the public awareness that they try to exploit. A tweet made the rounds, and you can see the tweet here, and it urged us, cybersecurity professionals, to join a community in order to do something about all these scams and this phishing. The community was called the COVID-19 Cyber Threat Coalition. You can see its website in the back. And I'm just interested, is there anyone here who was a member of the Slack instance of this community? Anyone in the room, show of hands? No, it could have been though, because at some point, it says here 3,000 members, but in the end it turned out that over 4,000 members joined the community because they wanted to help out with this goal. Okay, so we're going to investigate this community. First, its mission. What did they want to achieve with the 4,000 people on Slack? Their aim was, by sharing information across organizational boundaries, to generate threat information that they wanted to share with the broader public. Notably, they said they wanted to defend hospitals and healthcare organizations. And so, in a way, this was open source threat intelligence. Open source means it was freely available for everybody. Did it work? That's the question of our paper. You can see here the 3 research questions that we asked, that we studied in the paper, and that we're going to go through in this presentation. But I want to emphasize here that this is really a special community because it allowed us to investigate these long-standing questions on cybersecurity threat information sharing. This was possible because these people didn't come together because of compliance. You know, it wasn't public policy that mandated information sharing. It wasn't commercial incentives. It was intrinsic motivation. So that was interesting. Our methods, please have a look at the paper. We used qualitative and quantitative methods. It was a combination. And for example, we did some interesting stuff with regularly scraping these domains in order to find out if interventions had occurred against them. So first question, how did this community work? Like I said, over 4,000 people at some point. It was very active and also quite professional. And they had a number of outputs. One was that a group of administrators quickly formed and they started compiling these reports, these blog posts about ongoing active scams and internet abuse at that point related to COVID. And these administrators were also live streaming these town hall meetings, they called them, to try and inform and involve volunteers. Okay, but the main output was the block list, like I said. There was a lot of activity on Slack, but actually it turned out that just a few users actively contributed to the structured data format, alien vault OTX, that would be used to generate the block list. So that was kind of a shame, but something we've seen also in other communities, the same pattern. And also we saw that users submitted domains and IPs, but also companies. And over time, the company submitted data eclipsed the user submitted data. Does making this information available to everybody actually help? Does it improve the ability of defenders to act? So we looked at interventions. against the domains that were listed in the block list of this community. And we distinguished two categories that you can see in this figure here. On the left-hand side, you see all the domains in the block list. And on the right-hand side, you see the domains that were somehow related to COVID, which we distinguished using a list of keywords in 15 languages, like N95, for example, the masks. Okay. The difference between the two figures is that for the orange and the blue line, which are registries and registrars, the community, the CTC, managed to add more information. So they improved performance. They provided information that was new to the registries and registrars at the moment of publication, specifically for the COVID-related domains. So that was quite nice. That was actually somewhat of a surprise. And the other line in this figure is Google Safe Browsing, the green line, and it performed very well overall. You can see the quality, the fact that this list managed to add new data by the fact that it was included in the security DNS provider Quad 9. Okay, so does this collaboration in a large group actually lead to better coverage of threats? We said, yes, it can, but unfortunately the way this community worked and performed their vetting of these domains that were submitted, it kind of watered down the quality of the block list, which I'll show you. How this worked was that from all the submitted domains, the community administrators wanted to provide some level of assurance that it was actually true positives, that it was malicious. So how they did this, they used VirusTotal, right? You want something to scale. They used VirusTotal in a SOAR integration. And if there were fewer than 4 VirusTotal scanners that said that a domain was malicious, it would be thrown out. Between 4 and 10, a group of volunteers would look at the domain, and more than 10, it will be definitely included on the block list. Okay, so, and then there was also a group of domains, like I said, contributed by companies, and those were always included. But the problem with this was that there were in fact a lot of domains that had fewer than 10 VirusTotal detections contributed by users. Those are all on the left-hand side in this plot. This means that a lot of the domains that were contributed by users were thrown out the window. And the group of volunteers that had to evaluate them didn't scale with this process. So what was the result? Because they were relying on VirusTotal to tell them what was malicious, the output block list included mostly domains that were already known to be malicious, right? So it's kind of a loop you're creating. And as an effect, the block list was kind of downgraded to more generic phishing. So we found that the same list of keywords that I told you about that were related to COVID-19 actually made up a smaller share of domains on the list than just the word WhatsApp, right? Which is indicative of generic, very generic phishing. And this means that although they were able to improve performance for these domains specifically, they actually made up a very small sliver of the block list. Okay, we also found 75 false negatives, meaning domains that should have been on the block list by these criteria, but actually weren't. What does it mean? We say, yes, volunteers can aggregate timely threat intelligence over existing infrastructures. But in this case, really, it could have been so much better, the coverage of threats could have been so much better had the community really capitalized on those more than 4,000 volunteers. And what we hope is that when an opportunity comes around for a similar initiative like this, that someone will read our paper. So please tell them in case it happens. Because we discussed extensively a few lessons that we have learned. The first is that all those tweets asking people to join the community maybe weren't so necessary, because scaling up the community doesn't automatically lead to more or better data being propagated to the eventual block list. The second is Google Safe Browsing performed remarkably well, even for this new type of threat of COVID-related abuse. And third, this openness, this asking everybody to join and to contribute, it really asked for a new type of quality assurance process. Like I said, the process that was used using VirusTotal was somewhat flawed, but the community had an initiative for a crowdsourcing bot in which domains that were user submitted would be served to other users who would then say, yes, it's malicious, or it's a false positive. This was very promising. We were eager to see if this had worked, but unfortunately, it was only completed when the bot, the crowdsourcing bot, was only completed when most of the user activity had already tapered off. So there weren't really that many results to investigate. But it was very promising. Okay, finally, we looked only at the things we could measure. So we described the community in the paper. It had a lot of user activity. So on the Slack, people were talking to each other, helping each other. And there could have been, for example, takedowns as a result of that. But we investigated the block list and the quality that had. So that's an important limitation of our study. Okay, and with that, I hope you take a look at our paper. If you're interested in our work, we had some nice methodology that I didn't get around to explain. Not enough time in these 12 minutes, but I'm eager to hear your questions.